Aye.
Modis Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Carter.
Aye. Thank you very much. So the agenda has passed, and the minutes of our March 9th meeting are before you. Is there a motion?
So moved. Second.
Thank you. There is a motion and a second. Is there any discussion on the minutes? Roll call, please.
Fretham,
Aye.
Modis Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Carter.
Aye. Thank you very much. Our minutes have passed, and I will be turning this over then to County Manager O'Connor for our usual COVID update. County Manager.
Thank you, Madam Chair. Members, good morning. I believe it was a year ago tomorrow, we had our first COVID update here in the chambers with all of you. I believe you can go online and see it if you want. I hope I have the date right when I say that, but we today are going to focus on the public health update first, a little bit on return to work, and brief mention of the American Recovery Plan and steps forward. With that, I will turn it over to Deputy County Manager Kathy Hadeen.
Thank you, County Manager O'Connor, and thank you, Madam Chair and Commissioners. Today, I'm also joined by Dr. Ogawa, our Medical Director, and our Incident Commander, Laura Anderson. But first, let's move over to our dashboard to look at the numbers. In Minnesota, in total, 498,212 people have been confirmed positive for COVID-19. And unfortunately, we've lost 6,747 people to COVID from across the state. As we look at Ramsey County, we have 43,893 people who have been confirmed positive to date, and unfortunately, 805 people who have passed away due to COVID. If we scroll a little bit further, actually to the vaccine number right there, in good news, we have had 119,431 people in Ramsey County who have received at least one dose of vaccine, and 65,258 people have completed their vaccine series. As we move down, we can see the cumulative and weekly case rates continue to decline across Ramsey County. As of February 27th, the weekly case rate has dropped to 7.3 cases per 10,000 residents, and the positivity rate is down to 2.6%, which is the lowest in the metro area. While these numbers continue to stay low, it's important that we all continue to mask. We continue to maintain 6 feet of distance and get tested if you've been exposed or if you're experiencing COVID-19 symptoms. There was also an increase in the number of tests last week. Hopefully that is due to families with students who have returned to school and they're being proactive and getting tested every 2 weeks. As a reminder, you can go to ramseycounty.us/coronavirus and find information on vaccines, testing, translated materials, help for people like employment assistance, food resources, and housing resources, among many other things. If you click on the COVID-19 vaccine page, as we'll do today, we'll remind you who is currently eligible to get a vaccine. Healthcare, long-term care, educators and childcare workers, people who are 65 plus, specifically BIPOC community, and targeted essential workers, specifically those who work in the food manufacturing industry, have been added to our vaccine clinics based on direction from the Minnesota Department of Health. Be sure to get added to the min.gov vaccine connector to be notified when you are eligible for a vaccine. We will step away from the dashboard. Thanks for sharing that. A few more things. Over the past 2 weeks, we've partnered with Stair Step Foundation, M Health Fairview, Black Nurses Rock, and St. Paul Churches to provide 400 first doses to people 65 plus. We also continue to have mobile strike teams who have been vaccinating people in public housing, and these mobile strike teams caught the attention of a local hospital system's incident command staff recently, as they've been a model for how to take vaccine into housing sites versus having people travel to a vaccine clinic. So congrats to the team for working hard to do that. St. Paul firefighters have continued to work as vaccinators, and Metro Transit has been a partner helping to bus our residents to our clinic sites. I also had the opportunity to visit one of our large vaccine clinics sites this weekend and heard nothing but compliments from people who were both there getting a vaccine and those who were working and volunteering. We have hundreds of Medical Reserve Corps pleading with us to get hours to volunteer at these sites. One person named Heidi who volunteered posted the following tweet on Twitter this weekend. She said, "Just finished my first vaccine clinic volunteer shift, helping people to schedule their second vaccine appointment. The last person I helped today was a Metro Mobility driver. I thanked him for his work and how important it was. Now I'm just sobbing in my car before I drive home." Heidi went on to say, "The clinic helped over 700 people get their first vaccine shot. Super impressed by everything I've seen so far from Ramsey County Public Health. So thankful for the so many public health and medical people doing these. An impressive, hopeful site." We love seeing these thank yous. They help lift the spirits of people who have been working tirelessly through this pandemic to make sure our community has what they need. And one last note that I do want to share with you, commissioners. At the end of the month, I'm excited to share that we will be posting the public health director position. It's been a good opportunity to be in two roles at the same time, but we're to the point where everybody feels ready to post and bring in a new leader to lead the public health department. So with that, I will turn it over to Medical Director Dr. Lynn Ogawa.
You've received your vaccine. So we've been talking a lot about getting vaccine to individuals. We've talked also that it's not a cure-all. It doesn't automatically mean you can do everything that we did before. So the CDC has come out with recommendations specifically stating after you are at least 2 weeks after your second dose of Moderna and Pfizer, or 2 weeks after your single dose of Johnson & Johnson, individuals can visit with other fully vaccinated people indoors without wearing masks or physical distancing. This is welcome news to a lot of people who have missed sitting around and chatting with others without masks and being close to loved ones. You can also visit with unvaccinated people from a single household who are at low risk for severe disease. So this is where we make that distinction. It's not for individuals, though, who have underlying health conditions or who may still potentially get a serious disease, and so you have to be careful. You can also avoid quarantine and testing following an exposure from someone if you remain asymptomatic. The only caveat here is individuals who are who are healthcare providers, so myself actually included. I could not see patients directly for 2 weeks if I was exposed, because the patients by definition are at higher risk. And also people in congregate settings, we also still worry about individuals like in corrections or in detention facilities because the high turnover and the potential risk to those individuals. Also, however, most importantly, those who are fully vaccinated must still wear masks and physically distance in public settings and around those who are at severe disease. So again, we don't get to get rid of our masks. And because we don't want to walk around with a tag that says vaccinated or unvaccinated, we still need to be wearing masks in public. You must also wear masks and physically distance when visiting unvaccinated people from more than one household, again, increasing the risk of being exposed and still potentially carrying the disease. Avoiding medium and large size gatherings. And then the other component that the CDC is still pushing and still being careful about is travel. And with right now with spring break coming up, we just need to be aware that travel does increase your risk at being exposed to both variants and then also larger numbers of individuals, period. And so just because you're fully vaccinated, if you don't need to travel, really the recommendations are still not traveling. There's some really good data coming out of Israel about whether or not those who have been vaccinated can actually still pass on the infection, and it showed actually a 90% reduction in the risk of asymptomatic infection among those who are vaccinated. So It's interesting when County Manager O'Connor mentioned that we met for the first update a year ago. If I look back at the information that we were giving at that time, it's come a long way. And now even more so, there are changes to what we're saying and recommendations. And that includes that individuals who are vaccinated now have a reduced risk to others still, which is also good. It also looks as though when an individual who's been vaccinated gets infected, their viral load is lower overall, which puts them at a much lower risk for passing the infection on as well. But it doesn't negate the need for masks. The other thing that I was going to talk about today was AstraZeneca is another vaccine that we are looking towards and is being used throughout the World Health Organization and the European FDA equivalent to the FDA have approved for its use. Unfortunately, it's been put on hold again because of a statistical increased risk of blood clots. It's really not blood clots above the level of background, but there is enough concern that they've put it on hold. The concern about this is that AstraZeneca, which uses a viral vector similar to Johnson & Johnson, is one of the most mass-produced vaccines and could potentially bring vaccines to parts of the world that couldn't use the Moderna or the Pfizer. And so this is really unfortunate news because, again, this vaccine is well-tolerated, well-tested, but has had a few setbacks throughout its course and is not yet approved in the U.S. still. So. Again, this just highlights the information that, or the fact that this, the data is ever changing related to COVID, the vaccines to protect, and other things. I think I also mentioned previously that we had hoped that we would have data on children being vaccinated by summer. I was clearly overly optimistic. And really we're looking at, it's okay, I get to be optimistic every once in a while before I turn it over to our incident commander who gets to be the downer. But we're looking really more at best into the fall, into really winter and fall for children, and probably even not until the beginning of next year. Again, it's if children are less affected, we really want to get those individuals who have more severe disease vaccinated first. Also, there's some good studies going on in pregnant women and breastfeeding. It is showing some level of antibody crossing the placenta and potentially help, after vaccination, helping protect the fetus. Also, in breastfeeding, we know that antibodies are passed to protect as well. The numbers are low. It's not perfectly protective, but these are all good. This is all good information. So, the last thing that I was just going to mention is that, well, I get to usually talk about the science. There's the important component of getting vaccine to individuals, and Deputy County Manager Hadeen talked about this, is getting them to everybody. And access to healthcare and access to vaccines encompasses not just getting the shot into the arm, but it's getting populations the information that makes them comfortable with what we're delivering, to trust that the vaccine is in their best interest and is protective. And that takes all of the community outreach that we've been doing, all of the partnerships that we've been building, and it takes a consistency so that we can continue to expand the acceptance of the vaccine, get the vaccine to the individuals, and help protect the whole community. So it's just, again, I get to talk about the science, but the wholeness of public health is so important. So I'm going to turn it over to Incident Commander Laura now.
Thank you, Dr. Ogawa. County Manager, Board of Commissioners, happy to provide a report on our vaccine distribution process here within the Public Health Department. Our colleagues in planning have informed me just yesterday that we have provided almost 20,000 first doses to individuals who are currently eligible for vaccine. Our first clinic was, as you all know, at the end of December, so in about 12 weeks, we're talking about having provided around 16% of the first doses here in Ramsey County. That's a significant achievement, and I think it's something that we need to celebrate. Concurrently, we've also found ourselves, as we increase our ability to give those shots, having to make some changes in how we operationalize our work. So we have established new venues, and we've also continued to push into those mobile clinic sites that Deputy County Manager Hadeen just described. We're talking about going out to churches. We're talking about working with St. Paul Housing Authority. We're talking about supporting transportation, dealing with language issues, and also addressing internet access issues for our residents so that they can receive the vaccine. I don't really think we have a vaccine hesitancy problem here. I think we have an eligibility problem here, an access problem here. So I just want to say that directly. We have received a little bit more than 23,000 doses from our state partners. That includes doses reserved for the second dose as we continue to distribute Moderna. Yesterday, our immunization program colleagues pulled out the last 700 doses out of our freezer for today's clinic. It's a little scary, but we trust our partners at the state when they say that our shipments will arrive today. So happy to announce that. We have, as you all know, if you check out that vaccines provided by week, you will see a steady uptick in terms of the number of vaccines we are providing and the types of clinics we are hosting. One of the downsides of being so transparent and providing that data on a real-time basis is that we have seen some slight discrepancies in the number of doses distributed. So we've been working very closely with our state partners to reconcile the data from our clinics that are larger mass clinics as well as smaller clinics where we use paper screening forms. Sometimes there's a little bit of a lag time in getting that information to the state. Last week, we estimated that we would give about 4,000 doses. We ended up giving a little bit more than that, around 4,400 doses. This occurred despite 2 separate URL breaches. We understand that folks in our community are eager to get that vaccine, and they have been sharing that URL, but truly, personal public service announcement. If you see that URL out there and you did not receive it directly, please hold the line and don't share it further. We really are trying to encourage and increase the number of doses that are provided to our current priority populations. So, like I said, 4,400 doses despite those URL breaches, as well as some pretty significant competition from state sites for both teachers and childcare. So we were happy with those results. This week, we expect to administer a little bit over 5,000 doses, and our big push will be working alongside our colleagues in environmental health to get folks engaged with food processing to our clinic sites. That's really important. Those sites had some pretty significant outbreaks last fall and spring, and so it really makes sense to get the vaccine targeted to those workers now. So that's the update that I have for you, and now we are happy to stand for questions. Thank you.
And Madam Chair, before we go to questions, just 2 final pieces from my end. As it relates to conversations last week, the president last week in his primetime address announced that the federal goal is to have an available vaccine for every 18-year-old and over in the United States by May 1st. I want to clarify that that's on the quantity side, not on the distribution of said vaccine. And so that's an important part. There were similar conversations then here in the dial changing in the state of Minnesota last week, where Governor Walz talked about more workers being able to potentially return to workplaces, but still encourage that if workers have the flexibility to work remotely, that is the preferred alternative for all the reasons Dr. Ogawa mentioned today. This naturally brings up continued questions around our workforce about when is it okay to return to work. And I just want to reiterate the current direction with no change. We will reevaluate on Memorial Day our return to work approach. We anticipate it will take longer than that. We are in the process of working on a flexible work policy that will go beyond the pandemic and learn from much of what we've learned from already. We have a large organization that will likely take well into the summer for everyone to feel safe and vaccinated in the ways that we need to. And so Memorial Day will be our check-in, but we are likely to extend beyond that. And we don't see anything that changed in the last week to push us to make any changes in that particular space. We're going to continue on the path we're on, which is consistent with many of the large employers across our region, it turns out. Finally, on the American Recovery Plan, I think that's the correct title. If I got that wrong, I apologize. ARP. This is the other continued conversation at all times. And as I'm sure many of you got to talk about last week, I'm sure many people suggested for you many different ways to spend the $108 million direct allocation coming to Ramsey County. We could add all our numbers together and see what that ends up at in terms of ideas. Bottom line, we're thinking about it as an equation, 108 plus X. $108 million is the direct allocation coming to Ramsey County. The X is all the other things in the bill. Food and emergency assistance, rental assistance, testing and vaccination support, direct payments to families with children, direct payments to most American households. All of those items are also important for us to understand and actually understand before we have a conversation around the $108 million. We talked about building a matrix last week. That is in flight as we speak today. And I just wanted to let you know we have a workshop set for April 13th when we will talk more holistically about what we have learned from the funding matrix and what that might mean in terms of initial thoughts and prioritization around the $108 million spread across 2 years, so 54 and 54 million in direct allocation to Ramsey County. That will be the beginning of that conversation. By no means are we looking to reach final decision necessarily on that day, but I wanted to anchor the date of April 13th in your head as a way to begin the next phase of conversation around the American Recovery Plan. Thank you, Madam Chair and members. We stand for any questions that you may have.
So thank you so much for the ample update on so many areas of our COVID response and engagement. I have questions up from commissioners, and I will go directly to Commissioner Ortega.
Thank you, Madam Chair. My question, lately I've been having a lot of questions from constituents, and they all vary a little, but fundamentally it comes down to concern about addressing, they hear in the news about how communities of color and low-income communities need to be addressed in terms of because of their rate and so forth. And I guess I need to know, so when we break down the matrix, we say, 60 and over, 65 and over, whatever the criteria is, how do we make sure, I assure people that, because I have checked with our community clinics and I'm quite impressed with the work they've done in terms of moving the vaccine quickly to many of our communities, especially low-income communities. But it seems to be hyped up on the news a lot, so people react to that. And just want a clarification of how we're moving on that. And then the role of the state and the county. There seems to be confusion about that too. So just more clarification is probably good. Thank you, Madam Chair.
Madam Chair, Commissioner Ortega, I'll just at a high level, thank you for reminding us to talk specifically about this topic and continued efforts to ensure an equitable vaccine rollout, which will require us to see actually disproportionate shares of our underrepresented communities get vaccinated if we want to see an equitable outcome here at the end, because we've been behind. I'm going to turn to Incident Commander Laura Anderson to share additional thoughts on the ground.
Yeah, thank you, County Manager Ryan. Board of Commissioners, Commissioner Ortega, I'm happy to take this question. We have been actively assessing vaccine distribution to our residents who are also individuals of color. Currently, 25% of our doses, of our first doses given, have been to persons who self-report as people of color. That is in comparison with the state's rate of around 10% having given to individuals who self-report as people of color. We are very actively engaged in moving that number up. We have an outreach team that is specifically working to get more people of color who speak other languages access to the vaccine. So they actually do go out locally, help answer questions around the vaccines, and then support people in registering for appointments. We've also, our planning team has done great work in actually targeting lists to individuals in specific zip codes who are more likely to represent, who are more likely to be people of color, so that we get those folks vaccinated first. I think as we see the criteria change from the governor's office, we will see our rates improve, but we know that we have a lot of work to do in this area. So I thank you for the question.
Thank you, Commissioner Ortega.
Thank you, Madam Chair.
Okay. And I'll call on Commissioner Fretham.
Thank you, Chair Carter and everyone. I have a question from a constituent just asking, as Ramsey County is distributing vaccines, we know that vaccines, once they're pulled out of the freezer, need to be given within a certain amount of time. What is the process and prioritization when there is remaining vaccine after a clinic, and how is that distributed?
Yeah, Commissioner Fretham, that's a great question and also a hot topic for us. So we, as a local health department, like other health departments, like other health systems, do have an internal waiting list for those doses. So we have asked our occupational health and safety coordinator to help prioritize employees who are also client-facing, who cannot work from home, and who also align with the governor's recommendation in terms of eligible criteria, and we call down through that list. Typically, doses remaining at the end of the clinic could be as small as 2 to 4 doses. So we are looking for persons who can pretty readily answer the phone, jump in the car, and make their way to a clinic. I'm aware that this can cause a lot of frustration, really. These are small doses of vaccine, and I do wish that we had another structure in place to support providing those doses more equitably. At this time, I've asked our state partners for some guidance in this area, but the waiting list is an unfortunate product of having those doses in vials and needing to use them day of.
Thank you. Commissioner Reinhardt?
Thank you. It has been pretty amazing, and as far as the structure and how we are, the outreach that's taking place, trying to get those doses out, I'm very impressed. I think as we actually, as I go into, after the county board meeting, I'm going to, this last week, I'm always impressed by our staff and the organization and the dedication. But I think everything that I worked on, everything that we worked on last week, staff was just absolutely amazing. My question is, when we talk about the number of shots that were given, the number of Ramsey County residents that have had their shots, is that information from the Minnesota Department of Health, or is it, so for example, when I got my shot, it was out at the Mall of America, but I'm a Ramsey County resident, obviously. So do I count as a Ramsey County person that's vaccinated, or do I count as, I guess that would be Hennepin County, because that's where I got the shot. So and also, I mean, even the racial equity numbers, I mean, all of the information that we have, how is that actually counted?
Madam Chair and Commissioner Reinhardt, thank you for the question. You are counted as a Ramsey County resident, no matter where you go and get that within the state. So it's based on your residence and your address. And the numbers that we provide, what you see on our dashboard is numbers of people who reside in Ramsey County but have gotten vaccinated anywhere. The numbers that Incident Commander Laura Anderson gives numbers that we as a public health department and our partners have vaccinated as a part of our clinics. And I apologize if there was a part 2 to that question.
No, there wasn't, but I really appreciate that information. I know that we're getting a lot of calls and questions from our constituents about not just when their turn is, because I think people are getting to understand now that, that it is rolling out, and that if they are eligible, that they will get that information in relatively good order. But they still, looking at what other counties are doing, as you know, you're still getting calls and emails from us asking questions that our constituents are asking. And again, the information that we're able to provide has been very much appreciated by our constituents. So thank you.
Thank you.
Thank you very much, Commissioner. And Commissioner Mary Jo McGuire has the last question.
Thank you, Madam Chair, and thank you, all of you, for all of your work in getting the vaccine out. I really appreciate it. I have a couple of questions. I think it's just a clarifying question. I think it was our Director of Incident Command, but I'm not sure who mentioned something about it being an eligibility and access issue, not necessarily. If you could just clarify what that is, an eligibility and access issue, rather than I don't know if it was rather than a shots in the arm. Just if I could get clarity.
Commissioner McGuire, what I'm speaking to here is the reality that many of our individuals who are 65 plus in our community are not also people of color, and that our initial prioritization guidance was very much directed at individuals in specific healthcare occupations who also are not typically, have not historically those positions have not historically been occupied by people of color. So what that leads to is truly a really unfair drawdown in terms of how the vaccine is delivered. And we've done a lot of work to now effectively target and work with community organizations who represent persons of color to get those numbers back up. I feel very strongly, the folks I've spoken with who are also people of color want the vaccine. I don't truly think we have as much of a vaccine hesitancy issue as you might think. I think what we have is people want access to the vaccine and need to jump through a lot of hoops and barriers in order to receive it. So that's my perspective.
Thank you. Thank you for that clarity. I appreciate that. And that maybe goes to another question that I have, which is, I feel like I ask these questions every week, but our colleague in rural Minnesota said, well, we have plenty of vaccines here, and I'm wondering, is the state tracking this? Are they just giving out vaccines to everybody based on population? And I mean, it's really hard to hear that. I'm like, well, send them our way then, send them to us if you have an extra. And I know that I still have I think we all know people that are going out into the rural area to get their vaccines. So just if you could comment on how the state's distributing these and why other counties seem to have a surplus when we do not.
Madam Chair, Commissioner McGuire, what I would say is the state is watching those numbers very carefully. We have 8 regional healthcare coalitions who also watch those numbers very closely, and they do go ahead and reallocate and redistribute vaccine when they see it's not being taken as quickly as it could. They will redistribute and get it out to other partners. Statewide, there's been a lot of interest and advocacy within the metro region because of our population density. There's been a lot of focus recently around getting more vaccines to the Twin Cities, and I think that energy will continue.
And Madam Chair, Commissioner McGuire, if I could just add one other piece to it, I think, because I think about this a lot too, it's an important topic. I think there's a bit of like a math piece going on here, which is when you have such a large share of counties under 7,000 individuals or 5,000 people in our smaller counties, it's just simply easier for a specific county to be able to make that comment when you're talking about regional systems that span multi-county areas. And so while it may feel that way to one county, if you looked at the full region, the way the state is, those 8 regions across the state, it's going to look a little different. And Ramsey County, just by being a county with 500,000 people, is not going to hit that type of a spot. And so I do think it's a little bit of a numbers thing happening and a perception piece being a big part of that. But it does lead to those types of narratives, which can be tough on the ground to hear.
Yeah, and I appreciate that, and I just appreciate that this conversation, because it is what we're hearing and what other members of the public are hearing. So thank you for that discussion. So just 2 more questions, Madam Chair, and I think these might be for Dr. Ogawa. But one thing I think I know the answer to this, but and I believe this vaccine is long lasting, right? How long do they think these vaccines are going to last? So, I mean, sometimes we get vaccinated when we're little and they last us our lifetime. But do we know how long these vaccines are going to last?
Madam Chair, Commissioner McGuire, unfortunately, we don't. So you sort of know the answer to this question as much as I know the answer to this question. What we do know is that antibodies are lasting and persist at high levels at least 4 to 6 months post-vaccination. The thing about antibodies, though, is that they don't have to be at the highest levels in order to afford protection. They just have to be present. And so we believe that if you're exposed again after those first 4 to 6 months, you will still mount an antibody response and still be protected. But we just don't have the data yet. Like I mentioned, even the data on whether or not an individual could transmit it, we're only getting the data back now based on study that was done a few months ago. So this is ongoing. Again, another reason why we're saying don't trust the vaccine to protect you, and we still need to be wearing masks, and we still need to be distancing as we all get vaccinated, and as the rate of transmission reduces overall, we may be able to loosen some of those again, but some of those restrictions, but not yet. Yeah.
And I appreciate that. Thank you for that. And that goes to my last question, which, because it affects maybe a number of us on this call, is that we have a national conference coming up in July where they haven't decided yet what they're going to do about it, but it may be in person. And it's just curious what your advice might be, and maybe we'll have to wait till that comes. But I'm sure I'll be asking you closer to the time on whether a national conference is prudent at this time in July.
Yeah. So I'm not going to go out on a limb yet. I'm gonna come back on a weekly basis until I have more data to give you that answer.
Thank you. I knew I'd be putting you on the spot, but just curious, because I know that our conference planners are making the decision momentarily, and so we'll see. Thank you. Thank you for that, and thank you for all your work.
Well, and
thank you, Madam Chair.
Madam Chair, Commissioner McGuire, I think this actually kind of applies locally as well. I mean, I have to imagine the CDC gets that question right now from every trade industry group in the country daily as they're trying to just survive. And so I think the real hope would be that it doesn't require Dr. Ogawa on a Tuesday to give the final guidance, but that the CDC at some point feels comfortable issuing guidance around reopening in that space, similar to any other type of venue as they begin to reopen. And we'll make sure that we bring that information here if and when it becomes available.
Thank you. I'll call on Commissioner McDonough.
Thanks, Madam Chair. I want to go back to Laura's response to the access question. And so my comments a couple weeks ago on the golf course and using the word privilege and access there has generated quite a discussion, which I'm happy about. But I also feel like I just need to continue to call this out as a white guy that has actually benefited a lot in my life because of privilege. And Laura, what you identified there, all the occupations that get to go to the head of the line are occupations that have, institutionally kept people of color out. Those are occupations that pay well, they have benefits, they're rewarding, they're in demand, but they truly, and we're seeing it right now. You called it out, and I wanted to make sure I even took a moment here as a white guy to call it out even more. Even the age factor, life expectancy for folks of color are a lot less than us. And even how aging and how we treat people who age and people of color are different. We focus on the long-term care facilities. You can go into any long-term care facility and you're going to see the disparities. It's all white people. Folks of color get taken care of at home with their families because they don't have access to those. And it may sound like a broken record. You guys may get tired of me doing this, but I just committed that I want to continue to call this out. I want to continue to generate the conversations that are occurring. I want to continue to make sure that it's just not left unsaid, that we have to get up on the balcony here when you're so close to an issue. Like a guy like me, a white guy, when I'm so close to it and I benefit from it every single day, it can be hard to recognize and certainly even more harder to acknowledge. And, I thought a lot about it, whether I should even make these comments, Chair Carter. And I just feel like if I did make these comments, then I'm letting myself down. And so I just felt like I needed to make them, but I'm going to continue to do that. It's hard to make connections sometimes to the privilege of access through community activism on a golf course, to access to getting COVID shots, but the connection is institutional racism that has held people down and kept people away for so long. Thank you.
Thank you, Commissioner McDonough. Your comments are welcome. I do see Commissioner Reinhardt's hand. I'm not sure if that's leftover or if in fact you have something to say at this point.
Yes, Madam Chair, I do. And I think that this is an important thing to make sure we talk about. And in fact, I have an issue that's directly related to this. It's not, it's part of COVID, but you brought this issue up right now, and so I want to make sure that I highlight it. As was mentioned, the National Association of Counties conference is taking place right now, and one of the issues, and I know each of us in our committees have been very active, but one of the issues that I've been working very hard on is a proposed resolution out of the Environment, Energy, and Land Use Committee that did pass and will be considered by the NACO Board of Directors, is the, and I'm trying to make sure I get the right title here, the proposed interim resolution supporting the development of a national equity map. And this is knowing how conservative, quite frankly, the NACO board is. I'm hoping that they do see this for what it is. And it is about making decisions, policy decisions that are truly putting equity at the top of the list. And equity doesn't mean that somebody gets and somebody doesn't necessarily. What it means is that we are looking at everything so that we can make the best decisions. It also helps with the bottom line as far as taxes. But this is providing access to geographic data at a scale and resolution for policy decisions to be made. I just got a thing from Esri, which is, what is Esri? I've used it so many times. Basically, it's GIS. So, and it's a national or international, actually, organization. And it's learn how to jumpstart your racial equity work with GIS. Data is so critical, and that's what this proposed policy does. And I want Ramsey County to take a position in support of this, regardless of what NACO does. And what it is President Biden has an executive order which requires the chair of the Council on Environmental Quality within 6 months of the date of the order to create a geospatial climate economic justice screening tool. And annually publish the interactive maps. And also there is a Senate file, Senator Markey in Congress, that establishes the Environmental Justice Mapping Committee, and for other purposes. And I do think and for other purposes important. To make these decisions, we have to, as we do, I mean, prosperity, opportunity, well-being, accountability for all through the lens of equity aren't just words, as we've said many, many times. And I don't always agree. I mean, we don't always agree on what is and what isn't in that group. I quite frankly don't believe that that's part of what happened with the golf course, but that is my opinion, and I hold it just as strongly as Commissioner McDonough holds his, as an example. But I think that this is important. We are talking about it at the local level. We are doing things in Ramsey County that are trying to move that dial, which is not an easy thing to do, and talking about it and shining a light on it is one of the most important things we can do. The data is important so that we can, whether it's vaccinations or testing, or it's an environmental justice issue, and we know that it exists. If it's in education or employment or services being provided, we need to be able to meet people where they are. And that's what this provides us. So I hope, and I have been, I just broached this subject with our legislative staff yesterday and said, I want to bring this forward. And I know that we can take positions, but I wanted to make sure that commissioners had a chance to look at it. For those of you that are on the board for NACO, I hope that you will support this very, very strongly, because again, we don't just talk about it here in Ramsey County. We work our butts off to get it done. Sorry if that was too graphic, but I am, again, impressed with each and every one of the commissioners and staff as we are working through these things at a national level, and sometimes it makes people uncomfortable, but I think as Chair Carter has said, that's okay. We need to be uncomfortable or we're not going to make change. So I felt like if I waited to say this until we get to the legislative section of it, it wouldn't seem to be as impactful as far as us all being on the same page. And that's probably the most important thing for me in working at the national level, at the state level, is that when it comes to many issues, our base is that we are on the same page. We are working together on this, on the institutional racism and on the equity issues that are so critically important to our community. And again, it means that we are all valued. All valued, and that is so important. Thank you. Sorry about getting on a soapbox there, but I appreciate Commissioner McDonough.
It is okay. It's, I think, admirable that we have voices on the Ramsey County Board of Commissioners that will, in fact, take time to emphasize, as Commissioner McDonough has done, the issue of equity, its structural and institutional embedding in everything that we see and are a part of. It's important to recognize, it's important to acknowledge that this board has been working with our equity policy, our racial equity policy, with our racial equity community engagement response team, with our equity action circle, with structures such as transforming systems together, with all of the work that we've been doing over years to get to a point where we can center equity in our conversations. And I am just very thankful to be on this board, which also takes this conversation to a national level, such as you have shared with us, Commissioner Reinhardt. And of course, we will be supporting, as we are active in NACO, all of us, and uplifting that conversation, whether it is in environmental areas or in community and economic development or human services, as are many conversations starting there now and needing us in our focus and concentration to be able to do this work better. But for us, it is about recognizing the role that we have and the levers that we are able to use in breaking down the disparities that we see, whether it be in services or investments, and driving toward equity in Ramsey County, then partnering with others in our area and throughout the United States who are willing to do this work with us throughout the world. So thanks again. It's difficult sometimes to get through our meetings without centering that issue, because of course it is important in everything that we do. We do have a lot left before us today. We are going to move on with thanks to you two and others who I know are in the hallelujah nodding corner on our board on this particular issue. We are going to move on beyond our COVID update. I want to check back in with County Manager O'Connor before we have our mindfulness moment, and then we'll move on to our administrative items and updates and toward 2 workshops that we have yet scheduled for today. County Manager O'Connor, are there any final words?
No final words from us, Madam Chair. Thank you.
Thank you. Then we'll take our mindfulness moment as we're accustomed to doing in recognition of the trials, the 805 people passed, and the united and collective response in our county and in our country. Thank you. Thank you. It isn't a long moment, but it is intentional that we do this weekly. I appreciate it. We will move on to our administrative items. I'll call on Commissioner Fretham to take us through.
Thank you, Chair Carter. I'd like to move item 3, Environmental Health Fellowship Program Extension Request. I'd like to move item 4, Agreements for Youth Diversion Professional Services. I'd like to move item 5, Personnel Complement Increase to the County Manager's Office. And I'd like to move item 6, Appointment to the Workforce Innovation Board.
With no items pulled, is there a second?
Second.
Thank you very much. Again, all of the items on our administrative agenda, we have a motion and a second. Is there any discussion before we call the roll? Thank you. Roll call, please.
Fretham,
Aye.
Modis Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Carter.
Aye. Thank you. And the administrative agenda has passed. Our legislative update. Commissioner McGuire.
Thank you, Madam Chair. First of all, just to start by thanking our government relations staff of Jen O'Rourke and Melissa Finnegan for all their work, and then our team of Commissioner Modis Castillo and myself who continue to meet weekly to talk about the issues that are coming up. And so things are really happening fast at the Capitol. Last Friday was the deadline for the House, and this Friday the bills have to be heard in the